What I really want patients to know about me is my passion for listening and trying to help them with their problems, whether it be something they feel is minor to a really severe, life-threatening disability. My area of specialty in neurology is vascular neurology or stroke neurology, which entails looking at blood flow to the brain and when there is injury to the brain due to lack of blood flow. I work very closely with cardiologists to look at the reason or the etiology why patients suffer strokes. Sometimes there can be a little clot that can go from the heart to the brain, and we need to prevent that from happening again or from happening in the first place. And so I work very closely with our cardiology colleagues to evaluate the heart and to speak with our patients regarding different options for treatment. We start with stroke prevention, which includes taking care of hypertension, diabetes, weight control, and lipid control. Then if the patient does suffer a stroke, we have an incredible team that will work on the acute stroke patient. This includes using thrombolytic therapy, which is a clot-busting medication that has to be given within the first few hours of the onset of the stroke. Then we also have the ability to treat patients with large vessel occlusions, meaning if one of the large blood vessels inside the brain is closed off due to a clot, they can go in and pull out the clot and restore blood flow immediately and prevent long-term disability. And then finally, we work with post-stroke patients and work with them in rehab and in the outpatient arena. Because of all of this continuum of care, we have been awarded by the American Heart Association for the highest standard of care for our stroke patients. I think the most satisfying part of my job is the ability to connect with patients one-on-one and to hear really what's going on in their life and how I can help them.